Good day. My name is Duduzilan Ranga from South Africa. I'm delighted to share with you my project for this leadership journey, which is empowering inclusive health leadership to strengthen integrated and resilient health system in South Africa. So this project really is founded on the real problem that we see in our institutions of higher learning and research ecosystem, that women remain underrepresented in senior leadership across the health and the research ecosystem. The project is directly responding to this gap by intentionally building a sustainable pipeline of inclusive women leaders that are going to be equipped to strengthen equitability and integrate and integrate a resilient health system. What then we have set out to do in this project, we have a simple goal but yet impactful or powerful, which is to build leadership capacity and on, because women, we wanted to target women before they exit the pipeline. This project was piloted and launched at the University of Zululand, with deliberately choosing this institution as one of the historically disadvantaged institutions, with the aim of demonstrating that leadership excellence must be created equitably, inclusively across all contexts. And the approach for this is that as we develop this module or this framework, we want to co-create with the institutions and the participants themselves so that we can have participant ownership and also um, uh, impact the change that we want to see with the modules or the mentorships that we deliver. And these are the modules that we have sought to create with the participants. There are four modules that we structurally thought about in terms of empowering the early career scientists. And so far, we've got about 30 spelling from master's, PhD, and postdoctoral methods. And again, mentioning that we have a formalization of the two institutions, SAMFC and University of Zululand, who are willingly and have confirmed the participation in this program, which we are delighted for. Looking at my leadership growth through the lens of the four women-led pillars: authentic leadership, inclusive leadership, strategic leadership, impactful leadership. Really, it's about leading with purpose and values, emability in early career women and gender equity, and building partnerships across sectors, translating mentorship into change. So this is what I have learned over the past years, and intentionally and deliberately is putting these actions into play. Sustaining the momentum post the liftoff is that we want to now start rolling out those modules in the new year, and also engage national bodies for scale up, and also leverage on our networks, Women Lift, SAMRC, Cochrane South Africa platforms for visibility and expansion. And the vision, of course, is that we want to have the sustained pipeline of women leaders that will drive the equitable, resilient health system across South Africa and then expand to the southern region. So to close off, my reflection of my journey is that I've learned to lead with empathy and have inclusive teams and put mentorship that can drive health system impact into whatever decision or whatever project that I involved in. So this project really exemplifies leadership impact and personal transformation. With that, I would like to thank you so much.